Hi friends, I'm Dr. Priti Vyas from Sangeeta Hospital, Andheri West. I'm going to tell you about a very sad and disheartening story. I had a friend whose daughter came to us in a state of shock. When I say a state of shock, she was literally on the bed. She came in a state of shock. We were like, oh my God, what's happened to her? She came frantic. 11 o'clock in the night, I get a phone call. Priti, something's happened to my daughter. She was wincing in pain for the last 2 hours and now she's just collapsed. I said, just get her right now, immediately. She was a young 22-year-old girl studying in college, having fun. She was doing her law. And you know what it was? She had collapsed because there was bleeding inside the abdominal cavity, massive amount of bleeding. We removed around 1.5 liters of blood from her abdomen. What she had was a ruptured ectopic pregnancy. A ruptured ectopic pregnancy is when the pregnancy is in the tube and not in the uterus. It gives way and she just bleeds like a tap. This girl was having a boyfriend. She was sexually active and she had taken 3 emergency contraception pills in that month. Now that's not something that people do normally. Of course, she was scared to talk to her parents about it. She was sexually active only recently. She didn't know what to do. Google has all the answers. She went on the net, found out, oh, I just have to go to the counter, buy this pill and I'm going to be sorted. Every time that she had a sexual relation, she was popping an emergency pill. This is something which is really close to my heart because this is somebody who I know and she went through this, and I know so many girls who keep on popping an emergency contraception pill. Friends, it's important to know what an emergency pill is. An emergency is when there is really an emergency where your regular methods of contraception have failed, and that is the reason why you are sorting to an emergency pill. Like maybe the condom failed, or you thought that there was an IUD put and the IUD came out, or once in a while we landed up having a sexual relations without using a protection. But it is not something that you can pop at every sexual intercourse. Like if a lady has sex 4 times in the month and she has an emergency pill every time, it doesn't work. It's going to make the cycles go completely haywire, and in fact, it doesn't always prevent pregnancy because it has to be taken in that particular time slot. Sometimes what happens is that it just delays the ovulation, and then if a sexual relation has happened after that and she's again taken a pill, again it will end up delaying the implantation or making it get implanted somewhere else, and that is what happened in this girl where she landed up with an ectopic pregnancy. An emergency pill is to be used within ideally the first 24 hours of unprotected intercourse, and it is to be used once in a blue moon and not on a monthly basis. You know what? A regular contraceptive pill which comes in a pack of 21 days. An emergency pill is equivalent to having 7 of those pills all together at a time. Would you do that on a rational basis? Would you think rationally and say that, oh, I'm going to take 7 pills together today? I don't think so. But that's what girls do when they pop an emergency pill. So yes, it is to be used in an emergency but with a doctor's advice, and not rampant use just because it's available as an OTC product. We keep on buying and taking. It can do severe harm. Friends, really be safe. Take care. Friends, next week I'm going to give you all some tips on how to lose weight after delivery, on postpartum weight loss. See you next week. If you like our video, please subscribe, like and share our videos. And if you want, you can press the bell button. That will help you to get the fresh updates every week.